Thanks again for joining us for our virtual forum today, Exhausted, Addressing Compassion Fatigue for Addiction Treatment Professionals. We are pleased to introduce our presenter today, one of BrightView's behavioral health directors, Katie Spencer. Katie?
Hello, everyone. Thanks for taking time out of your very busy day, I'm sure, to join our call. I'm Katie Spencer. I'm the behavioral health director for Ohio at BrightView. I've been with BrightView for about 3.5 years, and for those of you who may not know, we provide outpatient substance use treatment across several states, but 36 centers here in the state of Ohio alone. I'm a LISWS with a background in both mental health and substance use disorder treatments. Of course, I did not start out in this admin role. I spent several years in direct care, and if you've been in direct care, you know what that looks like, sitting with patients every day, trying to hold space, trying to stay present, empathic, all while juggling the job and everything life is throwing at you. It's really meaningful, wonderful work, but it's also really hard sometimes, which brings us to our conversation today, talking about compassion fatigue and burnout, what they are, how they tend to show up, and how we can care for ourselves and for each other when we're in the middle of it. So I know this time of year tends to bring up about a lot of stress for folks. You got the holidays, end of year pressures, family dynamics, colder weather, shorter days. It can all pile up. So taking a little time now before we head into the thick of the season to check in with ourselves and learn what to look for. So, all right, let's get rolling. All right, agenda. So for our agenda today, we're going to start by talking about the difference between compassion fatigue and burnout, because even though those words get used very interchangeably, they actually really mean two different experiences. So from there, we'll dig into why folks in behavioral health and helping roles tend to experience burnout in the first place. Then we'll look at how to recognize signs in both ourselves and the people that we support. After that, we'll get into how to prevent burnout before it really takes hold. So how to support yourself and your team when we start to see those signs popping up. We're also going to touch on something called gap analysis. So basically taking a step back and looking at what might be missing in your work environment and what could make things feel a little bit more sustainable and supported. Then we're going to move into some tools, including ways to actually measure compassion fatigue. And then we'll end on a hopeful note, because despite all the challenges, the good in this work really does outweigh the hard days. So feel free to use the chat if you have questions or you have comments or something that really resonates with you. Please feel free to engage. I'm not going to be able to read the chat as I'm going through the slides, but I would still encourage that. And then we'll get to some questions, hopefully at the end before we wrap it up. All right, next slide. All right, so let's start about what we mean when we talk about compassion fatigue. So that term was originally used to describe the stress that comes from being exposed to people who've experienced trauma. So not the trauma itself, but the weight of walking alongside someone who's lived through it. And in our work, that's exactly what we do, but most of you do every day. We hear hard stories, we sit with people's pain, we hold space for their grief, for their fear, loss, when they're in crisis, everything in between. That kind of emotional presence, it's really meaningful, and it's what makes you very good at what you do, but it's also asks a lot of us because it requires us to keep showing up with empathy over and over again. So over time, that can take a toll, and it's not usually something that hits us all at once. Sometimes it's slow and it can sneak up on us. Sometimes it builds over weeks, sometimes it takes years. A lot of people describe compassion fatigue as this low-level fog that settles over the care when you usually have for people. So you're still doing the job, you're still showing up, but you're just feeling worn out and disconnected. You might notice you're going through the motions more than actually just feeling connected, right? So in the little things, stuff that might not normally bother you or wouldn't be a challenge, it starts hit a little harder, leaves you maybe feeling irritated, annoyed, or even drained. But the truth is, it doesn't stay neatly contained in our workday. It can spill over into how we show up in our personal lives too. So if we're not intentional about recovery, about our self-care, that emotional heaviness follows us home, and then it starts impacting how we show up, how we think, how we feel, and how we relate to people that we care about. Next slide. When compassion fatigue starts to set in, it doesn't just impact how we feel. It affects how we show up, how we think, how we relate to people, and our ability to function day to day. One of the first things people usually notice in this reduced ability is to feel empathy or sympathy. And it's not because we just suddenly stopped caring. It's that we're just very emotionally drained and it just feels like we're running on empty. So when that happens, we might start pulling away or isolating more at work and at home. Maybe you catch yourself avoiding your coworkers or not picking up the phone or replying to a text when friends reach out. Not because you don't care, but because simply you just don't have the energy to do it. You're just completely tapped out. At work, compassion fatigue can show up in other ways too. You might have a harder time just thinking clearly, hard time making decisions. You feel like you're kind of in a mental fog or just getting overwhelmed faster than usual. And when our brain is that tired, the chances of missing something important or making mistakes is naturally going to rise. And again, it's not because we're careless or we're incompetent, it's because our cognitive and emotional reserves are just depleted. Compassion fatigue is also linked to higher rates of depression and anxiety. And that loss of satisfaction or enjoyment in that work that we used to find very meaningful. I've worked with a lot of clinicians over the years, and I've heard this often. People start wondering, do I want to keep doing this? And they really start questioning their professional pathway. Sometimes the signs can look like attitude shifts or unhealthy ways of coping. So maybe some cynicism, some irritability, or turning to things like food, alcohol, doom scrolling, anything just to kind of get through the day. And sometimes it shows up physically, those unexplained headaches, stomach issues, or you're just feeling like you're constantly getting sick. And once you get over it, you're getting sick again. So that's the body waving its little red flag saying, hey, pay attention. This is happening for a reason. So recognizing these signs early does matter. And it's not a personal failure. It's not a character flaw. It's just your mind and body saying, hey, we're not okay out here. Next slide. All right, so now that we talked about compassion fatigue, I want to shift to burnout, which is actually one of the components of compassion fatigue. It shows up on its very own distinct way. So burnout comes from chronic workplace stress, the kind where you feel that work is just relentless and that you never really get a chance to calm down or get a break. It sneaks up on us when we're hustling towards our goals that just seem to keep moving as we get closer and closer, or the job expects us to pull off miracles, when everything is falling apart. But hey, they ordered pizza for lunch, so everything's okay now, right? One of the earliest signs is exhaustion. And I'm not talking about, well, today was really busy and I'm tired. It's that deep whole body fatigue that just follows you around, the kind where you are starting your day and you're already super tired. You just can't seem to bounce back between things like you might have used to. Then we have depersonalization. So that emotional distancing that can happen when we're feeling really overwhelmed. So you might notice you're going through the motions or you feel disconnected from your work or even from the people you're trying to help, almost just like you're on autopilot and just watching the day unfold instead of actually living and participating in it. Another big one is reduced performance. So things that used to feel really manageable suddenly feel like climbing Mount Everest. It becomes harder to concentrate, to feel creative, or to stay patient. And it's not because we've lost our skills, it's just because our bandwidth has been stretched very thin. And finally, burnout can come with this really heavy feeling and thoughts of, I'm not doing enough. I'm not good at this anymore. So start questioning your competence or your impact. Again, you might catch yourself wondering, should I be doing this? Does it matter? Should I leave the field altogether? So those feelings are not proof that you're failing. There are signals, and signals in the workload or the system or the environment needs to shift. And I just want to really stress this because I think it's important. It's the pressure around you. It is not about your worth or your ability and what you bring to the work. Next slide. All right, so burnout, it's not a medical diagnosis. It's not in the DSM. It's not something a clinician or a doctor is formally going to diagnose. It's considered an occupational phenomenon. So something that develops in the context of chronic workplace stress. So burnout's also different from mental health disorders like anxiety or depression, even though symptoms can look similar. So both can involve low motivation or feeling down, but burnout is tied directly to our work environment and the emotional demand of what we do every day. So it's also not the same as just general stress that tends to ebb and flow, that spikes and eventually settles. Burnout, on the other hand, It builds slowly and it just sticks around even when you're trying to rest and recover. It's not job dissatisfaction either. So you can genuinely love your work and what you do, and you can still experience burnout if the expectations, the workload, or the emotional demands have been heavy for too long. Burnout's also different from secondary or vicarious trauma, which comes from absorbing other people's traumatic experiences. So those two can overlap, but they're not interchangeable. And while burnout can be part of compassion fatigue, it's really just one piece of that bigger picture. They connect, but they show up differently. And then, of course, burnout can be worsened by things like chronic stress, trauma, existing mental health issues or challenges. So when we're supporting ourselves or when we're looking at what our staff might be dealing with, it's important to look at the whole picture and not just like what's right in front of us. Next slide. All right. We talked about burnout, compassion fatigue separately, but what happens when we put them together? So on the left, you'll see compassion fatigue. This comes from being exposed to other people's trauma over and over again. So we're not the ones going through the trauma ourselves, but we're holding the emotional weight of hearing it, seeing it, sitting with people in their hardest moments. And compassion fatigue doesn't always take years to build. Sometimes it hits fast, even after one really intense experience, because it connects directly to our empathy. Burnout, on the other hand, on the right side, that's the result of workplace-related stressors. So the workload, the long hours, the lack of resources or support, just an unhealthy work culture. So that burnout takes longer to develop. It's that slow build, again, that happens when chronic stress goes unchecked for too long. So to think of the differences in this way, compassion fatigue is the cost of caring, so that emotional impact of the work that we do. Burnout is the cost of the system, so the impact of stress, imbalance, and pressure in the work environment. So you also notice that compassion fatigue tends to improve more quickly, especially when we catch it early and give ourselves what we need: rest, support, boundaries, space. Burnout, though, usually takes longer because it's tied to bigger things around you. So your workload, the culture, the expectations, those pieces often have to shift before we really start to feel some relief. And if you look at the image on the right, it shows exactly how these things can blend together. So when burnout and secondary trauma overlap, that is often where compassion fatigue shows up. That emotional heaviness from the environment combined with the weight of other people's pain. So knowing which one you're dealing with, burnout, compassion fatigue, or maybe it's a mix of the two, helps us to figure out what we actually need. Sometimes it means checking the workload. Sometimes it means reaching out for support. And sometimes it's as simple and sometimes as hard as giving ourselves permission to rest, including taking those mental health days when we truly need it. Next slide. So up to this point, we've talked about what burnout and compassion fatigue look like on a personal level and how they show up in us, but the impact doesn't stop there. So these experiences ripple out into our organizations, our patients, and even our communities. So if we start with us, healthcare workers, compassion fatigue doesn't just affect how we show up at work. It impacts our overall health. We might start pulling back from others, which can look like isolation and avoiding social support. Some people cope with the emotional strain by increasing substance use or relying on unhealthy habits. It also raises the risk for anxiety, depression, especially when stress feels constant or unmanageable. Relationships can become strained even when because we might have less patience, less emotional bandwidth, and maybe some more irritability, just less tolerance for other people. We often see sleep issues like insomnia, and over time, chronic stress can contribute to physical conditions like including diabetes, because the body just stays in that heightened stress state. So these impacts are common and they're signals that someone needs support and they're not signs of weakness. So for patients, the impact is real too. So when we're exhausted or emotionally worn out, we're not going to present as we want to, not as our best selves. So that might mean we miss something, respond a little slower, or we just feel less connected. It's never intentional. It's just what happens when we're just running on empty. On a system level, burnout hits hard too. So high burnout means we have more turnover, we have more vacancies, fewer people to do the work. And that affects everything: access to care, cost, errors, satisfaction. And again, not because people don't care, but because you can't power a whole system on empty tanks. And the community feels it. So when the healthcare system is stretched thin, trust starts to crumble, disparities widen, our ability to respond to crisis is weakened, and the community feels a strain in very real ways. So when we talk about compassion fatigue and burnout, it's not just about self-care. It's really about caring for the whole system, the people around us, the patients we serve, and the communities that depend on us. So when we take care of ourselves and each other, we help to stabilize an entire ecosystem that relies on the work that we do. Next slide. So what actually makes something traumatic? Trauma can be from things people experience, so violence, neglect, abuse, or from things that just happen, like accidents or natural disasters. The trauma isn't the event itself, but our response to it and the way it might overwhelm our ability to cope. We're not always the ones living through the trauma, but we're surrounded by it. The stories our patients share, the crises we get called into, the tough moments we see every single day. After a while, that exposure can turn into secondary traumatic stress, the emotional weight we take on just from witnessing what others go through. It's like picking up part of the load of our patients are already carrying. And in our fields, overdoses are part of that reality. Being there for them, responding to them, losing people to them, those moments can really break our hearts, and a little shifts the way we see the world and how we feel in it. And everyone has their own threshold for what lands as traumatic. So every responder has their own things that hit a little harder. For some of us, it might be working with kids. That can be really hard work when we're parents or maybe experienced our own childhood trauma. It might just be hitting a little too close to home. And in this line of work, it might be responding to an overdose that reminds you of someone you love, or just losing a patient that you've known for months or even years. The important thing to remember is that trauma isn't a one-size-fits-all. It's personal, it's cumulative, and it doesn't always look dramatic from the outside, which is actually why we have to approach this work with awareness and compassion, not just for the people we serve, but for ourselves and our teammates who carry that weight every day. Next slide. So how do we recognize secondary traumatic stress, or STS, when it starts to show up? A lot of the symptoms actually mirror PTSD. Even though we didn't personally experience the trauma, our nervous system, it doesn't know the difference, so it just reacts. You might notice things like hypervigilance, feeling on edge, constantly scanning for danger even though you're in a safe place. Maybe it's difficulty concentrating, where your mind keeps looping back to something you heard or something you saw. Some people have nightmares or intrusive images. Others start avoiding people and places or activities that remind them of work. So a quick personal note, what came up for me in this is I remember when I worked in CPS many years ago, and my husband and I used to love watching Law and Order SVU, but eventually I couldn't come home and do that anymore. I was also a new mom at the time. So after hearing traumatic stories all day, watching a show full of trauma at night, that was just too much at the time. I needed something that didn't pull me right back into work mode. Secondary trauma doesn't just stay in our heads. It can mess with our sleep. That keeps us up replaying stories or throws off our appetite. We can eat too much, too little, not enough, or some of us just forget to eat altogether. So this is why STS sometimes referred to as vicarious trauma or secondary PTSD. It can be just as impactful as direct trauma, and it deserves to be taken seriously, both by staff and the leadership. The good news is recognizing these signs early gives us a chance to step in before things deepen through supervision, debriefing, leaning on our support systems, and just being really intentional about taking care of ourselves. Next slide. Toxic positivity. So most of us got into this field because we genuinely care about people. We're wired for empathy. We want to help, and we carry a real desire to ease people's pain. That's a strength and what makes you good at the work that you do. But over time, especially when we're exposed to ongoing stress or secondary trauma, we can start leaning on those familiar phrases like, just stay positive, look on the bright side, it could be worse. We can find ourselves using these types of responses with patients, coworkers. It usually starts with ourselves. And optimism can be very helpful. Sometimes we need that shift in our perspective, but it becomes a problem when positivity is used to shut down or avoid real emotions. So when we tell ourselves or someone else, just stay positive, we might end up brushing past the very real feelings we're experiencing, like exhaustion, sadness, anger, or even grief. So that's where toxic positivity comes in. When positivity stops being supportive and starts covering up what's actually going on the inside. So a healthier approach is slowing down and actually letting yourself feel what you're feeling without judging it. Even pausing just to ask, okay, what's coming up for me right now? It can really make a difference. And when you reach out to someone you trust, this is a big one, it helps to be upfront. Hey, I'm not looking for advice. I don't want you to fix this. I just need you to listen. That's a really good boundary set because a lot of the time we don't need somebody to fix it. We just want a space to be heard. For those in leadership roles, this matters even more. So creating a culture where people can express real emotions. It makes teams healthier, more resilient when we aren't selecting what we share, what we're comfortable with. We all know those sides of the conversations are happening when people are frustrated and overwhelmed, those side conversations, then that's damaging to a team. So it's important that we talk about these things together and work towards solutions and not piling onto the problem. And honestly, the only way to work through the emotions is to acknowledge them and not to bury them under forced positivity. Next slide. So now that we've talked about the cost of caring, I want to pause and highlight something equally important, which is the rewards of caring. So compassion, satisfaction is that sense of meaning and fulfillment we get from this work. It's that quiet reminder that even on the tough days, what we do, what you do matters. It is what gives us hope, strength, and a sense of purpose. The things that helps us come back tomorrow, ready to meet that next challenge, the next crisis, the next person who needs you. It's the steady acknowledgement that we are making a difference, even when we don't see the outcomes right away. And sometimes it's the realization that the same resilience and courage we're helping our patients build, we carry those qualities within ourselves too. Compassion, satisfaction can show up as a feeling of pride or inspiration, knowing that the way we show up comfort, motivate, or give someone enough hope to try again. And for many of us in substance use disorder treatment, it can also come from helping people push back against the stigma. Our patients are often navigating a world that judges them very harshly. So being part of the community that actually sees them, believes in them, and helps them heal, that carries a different kind of meaning. It can also show up as a sense of belonging, feeling connected to both the community we work in and the community that we work for. At its core, compassion, satisfaction reminds us that we are the bridge, the connection between someone who feels stuck or overwhelmed and the support they need to move forward, and that is powerful. When we're able to notice, nurture, and hold on to those moments of satisfaction, even the small ones, they become some of our strongest protections against burnout and fatigue. Next slide. All right, so let's take a moment to zoom out and look at the bigger picture of the work so many of us are doing every day. According to the National Vital Statistics System, in 2023, about 106,000 people in the US died from a drug overdose. That number is staggering, and it represents real people and real families. There is some hopeful news in all of this. Between January and April of this year, overdose deaths dropped to around 75,000, which is great. It reflects the impact of harm reduction treatment efforts, giving people better access to treatment, and having stronger public health responses. But even with that progress, we're still facing a very real crisis. In 2023, 69% of overdose deaths involved synthetic opioids, mostly illicit fentanyl, the main driver of this epidemic. And It might surprise you, maybe not. It's not just young people. Adults 65 and older had the largest percentage increase in overdose deaths between 2021 and 2022, up 10%. So this crisis now spans every generation. We also see significant disparities between 2020 and 23. Overdose deaths increased 39% for Native Hawaiians and nearly 3% for non-Hispanic Black individuals, reminding us how deeply inequities still shape outcomes in public health. Substances involved are shifting too. So nearly 1/3 of overdose deaths in 2023 included psychostimulants like methamphetamine, and about 28% involved cocaine, showing how common polysubstance use has become. And demographically, men ages 25 to 34 remain the group most likely to die from overdose, a group that often faces high stigma and tends to engage in care less consistently. All the data can feel very heavy, but it serves as an important reminder the work that we do matters. Every number represents someone, a child, a partner, a sibling, a friend. Every statistic is a life and a story. And that's exactly why taking care of ourselves and each other is essential. We can't support our communities sustainably if we're running on empty ourselves. Next slide. So the next idea, overdose compassion fatigue, OCF, takes compassion fatigue a little step further. So instead of looking at just the individual, it helps us to understand what happens to entire communities and systems are carrying the weight of constant loss. Overdose compassion fatigue is basically the distress that builds up when we're repeatedly exposed to overdose-related harm. The deaths, the griefs, the near misses, the constant crisis response. Even if we're not the ones directly experiencing the loss, being surrounded by it day after day can wear on a whole community. People start to lose hope, motivation, and even empathy. At the community level, that exhaustion can make it harder to work together. It can chip away at our adaptive capacity, our ability to stay flexible, creative, and compassionate in how we respond. And the research backs this up. So as described in the Bell tolls for the and thine compassion, fatigue, and overdose epidemic, when overdose compassion fatigue takes hold on a system level, it can start to erode support for evidence-based services. It can even fuel stigma-driven policies that blame people who use drugs instead of supporting their actual recovery. But there's another side to all this. So the same empathy that makes this work heavy is also what allows us to experience vicarious resilience. So that sense of shared strength and hope we get when we witness recovery, healing, and progress. So in other words, the emotion that makes us vulnerable to compassion fatigue is also the same thing that connects us to joy, meaning, and purpose that keeps us going in this work. Next slide. So what can we actually do to protect our teams and ourselves from compassion fatigue and burnout? It really starts with creating a workplace where people feel valued, supported, and safe. So that includes physical safety, things like proper PPE and safe conditions, but it's also a lot about psychological safety, where staff feel comfortable speaking up, asking for help, and naming when they're overwhelmed. We also have to acknowledge the reality we're living in. Economically, it's hard up here. And look, that old line that we used to say about social workers, we're not in it for the income, we're in it for the outcome. That might have sounded really cute once, but let's be honest, it's a little bit of nonsense. We deserve to make both a difference and a living. Providing a living competitive wage isn't just nice to have, it's essential. So when people are constantly worried about money, it's almost impossible to focus fully on the work. So that financial security reduces that background survival stress. Next, we need to normalize rest. So encourage mental health days, rest days, and make it clear that it's not just allowed, but that it's expected that people take them. That also means offering paid sick time, family leave, so folks can actually rest without the guilt or fear of finances. We also have to recognize the real life demands our teams are balancing. So childcare, elder care, medical issues, school schedules. And that flexible scheduling isn't just a perk, it's a protective factor. And this is the big one, promote care seeking as a sign of strength. So in our field, we're fantastic at telling patients to go get help, telling other people to go get help, but we're often the very last ones to seek it ourselves. So when we need is to model the behavior that we encourage. So maybe it's seeking therapy or supervision or our own peer support, some sort of mental health services. It's about making it normal and not an exception. And lastly, make sure your team has access to evidence-based trainings and practices. So it's not just about client care, but for provider wellness, so crisis response, harm reduction, self-care skills. The more confident and competent people feel, the more resilient they are. When we invest in our teams like this, we're not just protecting individuals, we're strengthening the whole system of care, making it possible for all of us to keep doing the work, the life-changing work in a very sustainable way. Next slide. So the next step is preventing burnout and compassion fatigue, is looking honestly at the culture we're working in, because no amount of bubble baths, deep breathing, or PTO is going to fix a toxic environment if that's what we keep coming back to. Self-care is important, but it can't compete with a workplace that's constantly draining people. One of the most powerful ways to create real change is by strengthening teamwork and communication. So when people feel connected and supported, they're part of a cohesive team, they are more willing to problem solve. They'll call out outdated processes. They'll suggest improvements and reduce a lot of unnecessary stress that builds up when folks feel alone or unheard. Leadership plays a big part, participatory management. So involving your staff in decisions, asking for their insight, and actually trusting them as partners in this. So that builds buy-in and helps to lower burnout. It tells people you're here and your voice matters. We also have to normalize having an open dialogue. Mental health conversations shouldn't just happen once a year at a staff training or maybe after taking a CEU. They should show up in meetings, talking about it during supervision in the day-to-day interactions. So when we talk about this stuff openly, it becomes more a part of the culture instead of something people hide. And there are practical tools that help too. So maybe anonymous suggestion boxes, check-ins, quarterly engagement surveys, all of those give staff a safe way to share what's working and what isn't. But collecting feedback is just the start. The real impact comes when we're responsive, when staff see what they said and what they shared actually leads to action. We should also regularly remind people, use EAP services. It's there. It's part of a benefit. If we have them, or to seek therapy and support when it's needed. So, and if we have to keep reinforcing this, asking for help is a sign of strength, not failure, especially in our field where we spend our days telling patients, right, to do the same thing. And finally, this part's crucial. We have to do something with everything we learn. So listening helps, surveys help, talking helps, but none of it's going to matter with action. And actually, if we don't follow up with action, it's probably going to make things even worse for folks. So when leaders and teams commit to openness and trust, that shared accountability and actual follow through, we don't just manage burnout, we transform the environment that causes it. Next slide. Compassion fatigue and burnout aren't fixed by one big thing. They're shaped by small, everyday choices we make to protect our energy and our emotional health. So one of the first and the hardest skills in this field is learning to say no. It's a whole sentence, right? So people who are natural helpers, we often feel guilty setting boundaries, but boundaries are not selfish. They're there to protect you. They're there to take care of you. Every time you say no, you're really saying something yes that matters more. Taking time off is another big one, not just when you're running on fumes. How many of us do that, right? It's like, I need to schedule mental health day. Rest should be shouldn't be a reward for burnout. It should be part of just your routine maintenance. And then there's reconnecting with who you are outside of work. Find hobbies, go back to hobbies or interests that has nothing to do with patients, paperwork, responding to crisis, something that reminds you you are a whole person and not just a provider. Another hard one, it's really important to limit screen time, especially after work and before bed. Our brains actually, they need that downtime, not constant notifications and doom scrolling. So sleep is another non-negotiable. So that's when the brain, it's repairing itself, it's processing emotions and resets. And if you need a little extra motivation, LeBron James, yes, I said LeBron James, whether you love basketball, love LeBron, or maybe your team NJ, or you don't care about basketball at all, that's totally fine. But he has a great audio, if you have the Calm app, about the importance of sleep. It's about 7 minutes long. I actually recommend it to everyone. He breaks down the essential of rest for performance, recovery, and overall well-being. So he talks a lot about how sleep is very important to taking care of himself. It's a top priority. And if you listen to it like I have, I'm just like, I need to go take a nap. I need to go sleep right now. It's really good to listen to. All right, and don't forget about your body. So move in ways that feel doable, getting up to go walk, dancing, yoga, cleaning, stretching. It's all really great. So especially if you're sitting all day long, like I do, like some of you probably do. So just getting up, anything that gets you out of your head and back into your physical self. So pay attention to what fuels your energy. So even small shifts like cutting back on caffeine, soda, or nicotine, that can make a big difference in how your body handles stress. There are also great tools out there for mindfulness and relaxation. Apps like I mentioned, Calm or Headspace, can help slow down your mind from the endless hamster wheel. And for folks who have been deeply impacted by trauma in this work, especially those who carry client stories home with them, things like EMDR can be very beneficial. It's been shown to help those with primary and secondary trauma. Most importantly, remember that self-care, it's not about being perfect. It's about showing up for yourself in regularly and consistently. If you aren't familiar with James Clear, he's an author. He wrote the book Atomic Habits. One of my favorite quotes from him that he says, he talks about it's important to focus on consistency over intensity. And I think that's really important to remember. Next slide. One of the most helpful things that we can do is simply notice what we're feeling as we're feeling, not labeling it as good or bad, not judging ourselves for it, just recognizing it. Another piece of this mindset, so the way we speak to ourselves, it matters. It matters a lot, more than we give it credit for. If our inner voice is constantly critical, dismissive, or negative, our whole system starts to respond to the world in that way. So paying attention to that self-talk is crucial. It can also be really helpful to name the things that are stressing us out. Sometimes it's just putting it on paper that gives clarity. What can I cope with better? What can I adjust? What can I limit altogether? And limiting sources of stress is absolutely a valid strategy. Turning off the news, taking a break from social media, or creating a little distance from people who might be draining your energy. At the same time, we want to choose things that add something positive back into our life. So that could be time with friends or family, walking your dog, participating in those hobbies, some small moments that remind you of who you are outside of the stress. Those meaningful moments are protective. And of course, we need to be honest about coping strategies that might feel really good in the moment, but actually in the long run, they make things harder, like drinking, gambling, or anything that numbs us instead of actually supporting us. Really, the heart of the slide is the emotional awareness. The more we can tune into our emotions without judgment, without pushing them away, the more control we actually have over how we respond. And that's what helps us to stay grounded, even when the world around us feels overwhelming. All right, next slide. So one of the best tools available to measure compassion fatigue and satisfaction is Professional Quality of Life Scale, or ProQOL. So this tool helps us to look at both sides of the work that we do, the positive and the challenging. It measures the fulfillment we get from helping others, but also the emotional strain that can come with it. So one of the best parts about it is that it is completely free. So we love that. Super easy to access, and you can find it at ProQOL.org. It's used all over the country in healthcare, behavioral health, emergency response settings. What it's really designed to do is help us to understand our professional quality of life. How well are we balancing compassion, satisfaction with a stress that can lead to burnout or secondary trauma? So it has 3 scales. The burnout scale, this looks at chronic exhaustion, frustration, or feeling overwhelmed by your workload and environment. The secondary traumatic stress scale, so this focuses on the emotional impact of hearing or witnessing others' trauma. And then the compassion satisfaction scale. So this captures the joy, the purpose, and meaning we get from the work we do, even on tough days. So this is not something you pass or fail. It's more like holding up a mirror to give you a snapshot of how you're doing right now. And once you see where you are, you can make more informed decisions about what support and boundaries or changes you might need or find helpful. So I would encourage teams to take this maybe a few times a year, maybe do it part of your supervision, wellness initiatives. Think of it as a routine maintenance and check-in for your emotional health. So we can't improve what we don't check on. Next slide. So now that we talked through compassion, fatigue, burnout, and ways to support ourselves and our teams, want to shift to looking more forward place. So a moment to think about where we are and where we actually want to be. So one tool that really helps with this is something called gap analysis. It sounds technical, but it's actually very simple and incredibly useful. So it helps to look at the space between 2 things. So where your current state is and where you want to be. So your current state is that what life at work feels like right now, your stress level, your workload, your support, your energy. Your desired state is what a healthy, balanced work experience would ideally look like for you. So start with the basic question. What are my current ongoing stressors? Maybe it's a high caseload. Maybe it's too many administrative tasks. Maybe it's unclear expectations or just feeling really emotionally drained every week. Then you shift into imagining, what do I want this to look like instead? So if things were functioning well, what would feel different? What would look different? Maybe you'd have better communication from leadership. Maybe your caseload would be more manageable. Maybe you'd have space between sessions to feel like you can breathe and regroup and think. Once you've named those 2 ends of the spectrum, the middle piece is what we call remedial action. So basically, how do I get from where I am to where I want to be? So some of these steps might be personal, things that you can adjust, your routine or your mindset. Other steps might be organizational, like asking for clear communication, advocating for flexible schedules, and pushing for better support systems. And sometimes that gap exists not because of anything that we're doing wrong, but it's because of the system itself. It's rigid, or maybe it's unrealistic. Or maybe you've been in survival mode so long that imagining something better feels really strange or impossible. And that's normal to experience. The key here is staying open-minded that change is possible, both personally and organizationally. When we're honest about these gaps and we talk about it openly, we can start to take meaningful steps towards closing them. And the important part is we don't do it alone. We have to be able to do it together. Next slide. So as we come to an end, kind of close to it, I want to bring us back to the why this conversation matters. So at BrightView, we asked 325 patients a series of questions about recovery and what they learned, what's kept them going, and how they've changed. And their answers are such a powerful reminder that the work you do every single day truly changes lives. So when we ask people what people misunderstood most about recovery, one patient said, "We're not bad people trying to get good, just sick people who want to get well." Another one said they wish others understood how much we depend on others for our recovery and support. And right there, that's all of you. You are that other. You are the lifeline they're talking about. When we asked what helps keep them in recovery, someone shared, "I was tired of being tired. I had reached rock bottom. I either had to change or die. Dying didn't sound like too much fun." Another said, so simply and so honestly, I would have died without their help. And when we asked how they changed the most, we heard things like, I'm more honest and dependable. I'm finally contributing positively to society. And the one that sticks out for me is, I actually want to live and I have begun to love me. Love that. So these are their words, the voices of the people that we serve. But they're also proof that your compassion, your patience, your presence, your commitment, all of it matters more than you might ever realize. So yes, this work can be exhausting. It can be heavy, but it can also be profoundly meaningful. And every one of you is a part of these stories, these outcomes, these moments of hope. So thank you for showing up. Thank you for caring. And thank you for continuing to make a difference, not just today, but every day. All right, next slide. All right, so as we come to a close, I want to leave you with a few final thoughts, reminders for all of us who spend our lives helping others. The first is, you don't heal the wounds, you will bleed on those who didn't cut you. So in this work, we are the helpers, the listeners, the problem solvers. But if we never tend to our own pain, it eventually spills over into the people and places we care about the most. At the end of the day, the rescuer can't rescue anymore if they become the one in need of saving. The next quote is, it's not the load that breaks you, it's the way you carry it. We can't always control what life or work asks of us, but we can control how we share the loads. We can build systems of support, lean on one another. Remember that asking for help, it's not a weakness, it's actually wisdom. And of course, we could not have any conversation about compassion and humanity without a little wisdom from Brene Brown. So she says, many of us are willing to extend a helping hand, but we're reluctant to reach out for help when we need it ourselves. It's as if we divided the world into those who offer help and those who need help. And the truth is that we're both. And that's really the heart of it. We're human, we're here to help because we've known struggle, and we heal when we allow others to help us too. So again, thank you for the work that you do, for your compassion, what you bring into the rooms most people will never see. So thank you for showing up, especially on the days when it takes more out of you. But please, please, please take care of yourself and find the support that you need. And I appreciate it. All right, so we'll go into questions now. And we have a few minutes left.
Thanks, Katie. We are going to go ahead with the Q&A of today's discussion. Feel free to drop any questions that you may have in the chat, and we will try to get to as many as we can. To kick things off, Katie, do you have any recommendations or strategies on how to address burnout with a supervisor without any fear of consequences?
Hard one. Steps I would say is it's best to have the conversation. And I can understand that it can be scary and think about what might happen, but there also might be some really good things that happen. So I think being able to just be prepared about what you want that conversation to look like, maybe coming in with some examples of what you think isn't working, maybe some things that you want to see. I think that's important as far as like advocating for ourselves and feeling empowered, even when we're really afraid to maybe take that step. So I would always encourage communication. Another Brene Brown, is clear is kind. So I definitely would encourage that.
Absolutely, great advice. How can we navigate working with coworkers who are burnt out or disengaged and might be causing problems within the team, whether that might be affecting team morale or even creating additional work for others?
It's hard. That's hard with other folks because we want to give them the space and the grace to have their feelings and when things are hard, but it becomes very difficult when we feel like it's impacting us, when it's impacting our whole team, and we know that that's going to impact patients as a whole. So again, I think it's about figuring out how to have that approach and have that conversation, be each other's eyes and ears, because it's about putting the patients and the work before that person really. And it's also coming from a place of care. I mean, we work with people that we care about. We want to see them do well because when they do well, our patients do well. And if you're not comfortable approaching having that conversation, if that's like, oh, that's too scary, I don't want to like get in the middle of all that. It could just be about setting boundaries. So if you have a coworker that is constantly coming to you and it's draining, they just have a lot of negative energy. You don't have to get sucked into that. It's really easy to do, but just being really mindful of it, of wanting to set boundaries, staying solution focused. And I think when we lead teams, that's also something that as leaders, we have to be responsible for, is having those crucial conversations and paying attention. And really, it's just about caring about that person. Obviously, that person or people are going through something really tough. So really kind of leaning into what is the solution and how we can provide real support.
Our next question comes from an attendee. Can you talk a little bit about when we might be experiencing clients who are experiencing compassion fatigue for the other people in their life, and what are some interventions that we can implement to help our own clients?
Yeah, that's a great question. Some of our patients are also helpers and want to support people in their lives. And I think it's important to just create a space for them to talk about it. And depending on what capacity that we're helping them in, is reminding them to also take care of themselves and how much of that they can actually should carry, and maybe what that communication with that person that they care about looks like. What are some things that they might be doing that might be making them feel worse, and what are some things that might make them feel better? You know, really looking at some of those boundaries, right? So some of our patients are very enmeshed or very codependent with people in their lives they care about. So helping them to kind of reset and refocus on themselves and how to have healthier relationships. And you can still care about people, you can still show up, you can still be worried, but how to do it in a way that isn't going to impact your function every day.
This is another question from an attendee. What about people who say that they could never get burned out and that they love their job and they don't understand why other people get burned out? Is this a red flag?
I'm happy for those people. I don't know if I've heard that, but you know, there are some people who are just maybe they're just in that honeymoon phase. Maybe they're newer in the field. Maybe they genuinely just haven't had that experience yet. So I don't think it's really potentially a red flag per se, but you know, allowing people to have the experience where they're at. Like if that doesn't bother you, great. Maybe they are avoiding, maybe there is some denial, but is it impacting me? Is it impacting our team? I think it's just important to be present so that if that way the bubble bursts for that person, because it might, if they stay here for a while, that we're there to support them if that changes.
This is another great question from an attendee. How can we deal with feeling like a constant provider? They feel like they're constantly giving or being asked for things, but sometimes it's draining to have to constantly provide support.
Yeah, I think that's just like at the heart of our whole conversation today, is that when we feel, what I hear in that question is, I'm on E and have to do one more thing, and just feeling stretched very thin. I think goes back to all those things that we talked about today, as far as it's great to have that awareness. So the person that asked that, it's great that you are aware of it. That's a great place to start, because when we're not aware, it's really hard to change things. But taking that step back and looking at physical health, emotional health, maybe where we need to set some boundaries. Are you doing things outside of work? You know, going back to that whole piece of remembering that you are not just a fill in the blank provider. You're not just a social worker, a counselor, or nurse, or, you know, manager, who you are outside of work. And so is there some imbalance there? And so like, what are some things that you can do to bring some more balance? And for some folks, again, going back to what we talked about, it might be seeking out some therapy if that might be helpful for someone. There's a lot of pathways to get some help and support. It's just being willing to kind of explore what that might be and what might be best for that person.
I think we've got time for one more question. Can you talk a little bit about what happens or what solutions might be available for folks who talk to their supervisor, and maybe they're trying things outside of work, maybe they're doing all the things for themselves, but the workplace part is still not falling into place, or the supervisor doesn't have a lot of solutions. And I'm going to couple this with another question. When is it time to maybe think about changing careers or changing employers? How do people navigate that decision?
So I think a very personal decision. If you're in an environment where things haven't changed and you've kind of taken all those steps, at the end of the day, it's asking ourselves, is this where I want to be? Is this where I feel valued and supported? Is this where I feel like I can be my best self and really serve patients? And unfortunately, not every organization is going to support that. And so, for people who put a lot of time and effort into their education and their license, it's a really personal choice, I think, at the end of the day, to make that decision and reflect. Is it time to seek out something else? Just to kind of reflect on, maybe I'm getting pulled to do something different, but you have some wonderful skills that you can use in another profession. So taking some time to kind of explore that, I think, is important. But I don't think we should stay in an environment where we don't feel heard or supported after we've really made some efforts to try to be a part of some of that change.